Uh, as stated earlier, we're happy to have Sandra D'alessandro with us. I told you she's a CEO of our home healthcare company here in Ontario. We'll just take a couple of minutes to chat with her, and then we'll finish up with some Q&A, and then let you get on your way. So, Sandra, again, thank you for joining us. And as I said, you're running your own home health care company. Maybe you can just give us a quick snapshot of your story, where you've been and how you got to where you are now in home health care.
Absolutely. Thanks for having me, Alan. I started working as actually a homemaker before I got my PSW certificate for a large company here in Niagara, and it really sparked something in me. I just enjoyed helping people. I always have. After a few years, I decided to go and get my PSW certificate, and I started working for various home care agencies throughout the community. And my first experience with my very first client as a PSW brought a lot of light to why I'm doing what I do today. I walked into her home and I asked her if she would like to sit down, have a tea before I started her shower. It was my first meeting with this patient. And she looked at me kind of odd, and I explained to her that I would like to get to know her a little bit before we went on our day and got her ready. And she was very taken back. She said, everybody's just rushing me. If I don't want to have a shower, they just leave. So we developed a very strong relationship, and as time went on, I realized I couldn't fix the world and I couldn't help everyone. And I moved on to a nursing home setting. Within my nursing home setting, I felt it was very sterile and we were always rushing. We never had enough time. So I moved on from the nursing home setting and decided to go out into the community and provide my services to other people that needed it. I started off with a woman named Lois, and I cared for her for 3.5 years. And when she passed, she left me this beautiful letter, and in this letter, it inspired me. She wanted other people to have the opportunity of being able to stay in their own home. And she, in return, left me enough money to start this company. I also took care of my grandmother for 5 years at home with full-blown Alzheimer's, which is very devastating for any family member to go through. So I was lucky enough to have the knowledge to be able to care for my own family. I now currently have a home health care agency in Niagara and 15 years in business, going on the 16th year with great success. We've grown tremendously from it just being myself to 65 staff all across Niagara, and we are growing increasingly every day. There's such a need.
Oh,
So
thanks,
that's
Sandra.
how I got started.
Awesome, thank you. And for those in the U.S., just a note, PSW stands for Personal Support Worker. Equivalent is your HHA and perhaps CNA. So why are you passionate about solving the caregiver shortage problem, Sandra?
My passion has always been about helping others, and what's happening right now, I see such a huge need. I have two great role models, my grandmother and Lois, who started my company, and they saw the need back then, and my passion is driven daily by how many people we help, and they are so grateful.
So, you know, your business is growing. I know you're signing up new avenues of business, and you're going to be faced with some issues like caregivers. So, how do you think that is all going to help you manage your business, and how do you think perhaps an on-demand marketplace might fit in there?
I think it's going to be fabulous. We are in crisis now. We have been the last 2 years, and it's increasingly getting harder. My company is dedicated to our clients, and we struggle every day with call-ins, across the board. Just this past weekend, we had 12 call-ins. So we make it work. To date, today, we have not missed a visit with a client or a patient, and it has not been easy. So it's tireless, and we are a 24/7 business that doesn't stop. So this marketplace is going to be great for everybody across the board.